Gurmagat Cian Corla. As colleagues will be aware, on Monday, Government made the decision that the entire country should move to level 3 of the COVID framework plan. This came into effect on midnight Tuesday for 3 weeks. The decision, Cian Corla, was not made lightly. I am acutely aware of the costs of these decisions to individuals, to families, to communities and to businesses. The level 3 measures in place are as they are for Donegal and very similar to the measures in Kildare, Laois and Offaly in August. The following are the measures as per the framework for level 3. Meeting up with no more than 6 people from one other household, a maximum of 25 guests at weddings, no indoor organised events, gatherings of up to 15 people for outdoor organised events, groups of up to 15 for outdoor non-contact training and individual training indoors. No matches or other sports events except for professional, elite, inter-county, club championship, horse racing, and all behind closed doors. Individual training in gyms, pools and leisure centres. Religious services moving online and up to 25 people at funerals. No indoor dining or service for restaurants and pubs, and up to 15 people outdoors. The one exception to this is wet pubs in Dublin, which remain closed. For hotels, guest houses and B&Bs, services are limited to residents. Indoor cultural venues are closed. People should attend work only if absolutely necessary. Work at home where possible. People should stay within our own counties except for work, education and other essential purposes. Only use public transport when necessary. Schools remain open, colleges remain open, childcare facilities remain open. I should note, Cian Corla, that healthcare facilities remain open. Visiting is suspended for care homes aside from critical and compassionate circumstances. These are difficult measures for anybody to follow. For a number of weeks in August, the people of Kildare, Laois and Offaly lived through a set of measures very similar to level 3. And this was not easy. But because of their work, because of their commitment, because of their solidarity, and because of their determination, COVID-19 was pushed right back down in these counties. The people of Donegal and Dublin have been living through level 3 measures for several weeks now, and they too will attest to these measures being difficult. It's too early for the measures to have reduced identified positive cases in Donegal. However, we are seeing an impact in Dublin, where the growth rate of cases has been brought right down. The government and indeed agencies right across the state are acting in many other ways too in response to COVID. Additional funding has been sanctioned for An Garda Síochána to support enforcement. Testing and tracing is being further strengthened. Additional technologies, including antigen testing, are being examined. Remote learning is being increased for higher education. Additional business supports have been introduced. Additional funding for nursing homes has been sanctioned. We have launched the €600 million winter plan to help protect patients and protect our health services. This includes funding for approximately 900 hospital beds or acute beds, 500 subacute beds, 5 million home care hours and much more. We're doubling the public health workforce. The government has followed much of NEFIT's advice. This includes the framework itself, the recommendations for additional enforcement, the recommendations for additional inspection and communications, and indeed the recommendation to increase nationally from the level we were at. Colleagues will be aware that while government decided to move to level 3, NEFIT did recommend moving to level 5. Correspondence from and public statements by most political parties are in line with the decision by government to not move to level 5 from midnight on Monday last. Government believed the conditions in the framework for moving to level 5 have not all been met. 3 days earlier, which was the Thursday, NPHET had met and advised government to keep Dublin and Donegal at level 3 and the rest of the country at level 2. The HSE confirmed to government it has sufficient capacity to manage existing COVID cases, and it is not projecting any immediate difficulties in this respect. Government would also like to see more detail on options for the end of a 4-week period at level 5. In its decision, Ceann Comhairle, government considered the health, social and economic consequences of a move to level 5 at this time. We noted Israel is the only country currently following such a strategy. We concluded that the best way forward was to follow NPHET's advice on enforcement, communications, increasing nationally the framework level, and to do so at level 3 rather than at level 5. Countries across Europe are seeing an increase in cases, and these countries are also taking action. Ireland is currently mid-table in Europe. European countries with higher rates include Spain, France, the United Kingdom, the Netherlands, Belgium, Austria and Denmark. And as colleagues will be very aware, cases are rising fast in Northern Ireland. We are in communication at official level and political level on how best to coordinate our responses on the island of Ireland. There has been discussion today about the chronology of events over the weekend. I received a text around lunchtime on Saturday from the Chief Medical Officer to say he had called a meeting of NPHET for the following day. I texted the Taoiseach to let him know. Early Sunday morning, I texted the Chief Medical Officer requesting a call before NPHET, and on the back of that, the Chief Medical Officer and I spoke. We discussed the current situation and the possibility of moving to level 4. I conveyed my belief that it was important NPHET adhere to the parameters set out in the framework for each level. I contacted the Taoiseach afterwards. Around 7 p.m, I took part in a video call with the Chief Medical Officer, the Deputy Chief Medical Officer and the Secretary-General. That is when I was informed of NPHET's recommendation to move to level 5. I updated the Taoiseach after this call. A Cabinet COVID committee was convened for noon the following day, and Cabinet met later on the Monday as well. I'd like to provide colleagues with an update on the epidemiology as of today. The 14-day prevalence rate per 100,000 population is 128. Just 2 weeks ago, Ceann Comhairle, it was 76. Counties with the highest rates right now are Donegal at 319, Monaghan at 257, Clare at 183, Longford at 169 and Roscommon at 166. 506 cases were notified today, with 35% coming from a close contact of a confirmed case. 492 new clusters were notified in the past week to the 3rd of October. The latest estimate, which was calculated as of yesterday for the R0 number, is now 1.2. It's important to note that regardless of what level Ireland moved to this week, case numbers and hospitalisations would continue to rise for several weeks. This is because it takes several weeks for the measures to impact on confirmed cases and hospitalisations. Ceann Comhairle, we now have the opportunity to arrest the spread of COVID across our country. This means us all following the measures in the framework. It means following the basics of hand washing, face coverings and social distancing. It means reducing our contacts. Earlier this year, we flattened the curve right across Ireland. In August, the people of Kildare, Laois and Offaly did the same. Right now, people in Dublin and Donegal are working hard to do it again. Our ask is that once more we all step up, we all follow the measures and suppress this virus. Ceann Comhairle, I believe that once again we will be more than up to the challenge. Thank you.
Sure,